Good morning, everyone. My name is Janet Nudelman, and I am the Senior Director of Program and Policy at Breast Cancer Prevention Partners. And I would like to welcome you on behalf of BCPP and our partners at Black Women for Wellness to today's presentation, Toxic Beauty Products and Black Women's Health, a webinar for nurses. 228 nurses from around the country representing a variety of specialties registered for this webinar. Wow. We could not be more excited to share with you today the Campaign for Safe Cosmetics Non-Toxic Black Beauty Project, created to address the overexposure and underprotection Black women experience to the toxic chemicals in the beauty and personal care products marketed to them. A self-regulated multi-billion-dollar cosmetics industry creates a problem that impacts everyone, but especially Black women. And that's why today's webinar is focused on why Black women are especially at risk. We believe, and we hope you do too, that nurses have a special role to play as frontline workers to help respond to this growing public health concern by sharing information and resources about this problem with their patients. I am the Senior Director at Breast Cancer Prevention Partners, and we are the only national science-based advocacy organization working to prevent breast cancer by eliminating the toxic chemicals linked to the disease. We work with highly impacted communities, translate the science into education and action, pressure companies to make safer products, and advocate for health protective state and federal laws. I also direct BCPP's Campaign for Safe Cosmetics, which for the past 18 years has generated consumer awareness and demand for safer products and comprehensive cosmetic safety laws that protect everyone, regardless of where they shop, work, or live. Now I'd like to invite my colleague Astrid Williams to introduce you to Black Women for Wellness, who is co-sponsoring today's webinar.
Just to introduce myself to you as well as our organization, my name is Dr. Astrid Williams, and so glad to be here to co-facilitate this presentation, much needed in the line of work that you all do, to be able to share this information with your patients and your community. Black Women for Wellness has been around since 1997, so we're about 25 years old, and we've been in the community doing this work. We are a 501c3 nonprofit that's based in South Los Angeles, and we do the work around health education, advocacy, and empowerment. Our mission is to uplift Black women and girls, and we do that through a variety of different programming. As you can see here on the right is comprised of a list of our many different programs. But I'd like to mention that our organization and what we do is rooted in the reproductive justice framework. So you will see that in all the work that we do in the many intersections that we have. And not going to go through each program specifically, but just like to highlight a few in terms of the work. We do sexual health education with our Get Smart Before You Get Sexy, as well as a comprehensive sexual education around STI prevention and awareness about, sexuality with our Grown and Sexy program. And then the health education comes out in the realm of our Kitchen Diva program, which is a plant-based cooking demonstration, which currently we do virtually online. And then in the local community, we do food distribution. That's all, excuse me, local and fresh produce that we, partner with local farmers and growers. And then our civic engagement program is also one of our other, highlights of the work that we do, having various campaigns and, working with the electoral and getting the information out to our community. With that, wanted to note that we have our Sisters at 8 program, which we have one tomorrow, which hopefully you can join us if you can find more information on our website. It's the second Friday of the month, and this upcoming one is very relevant. It'll be talking about inflation and unemployment and some of those factors that relate to the community. And so just wanted to put a highlight feature out for that tomorrow at 9 a.m. And then what we're here to speak about this morning is our environmental justice program and how that relates to the work that we do. So we like to share our environmental justice program in two different facets. And so as you can see here, it's broken down into the built environment and then beauty justice, which is what we'll be sharing more about on the discussion for today. Just like to note, our team is myself, as I introduced with you all, and our environmental justice program lead, which is Tianna Shaw-Wakeman, and she's a rock star stellar addition to our team, and you'll be hearing more from her and in their presentation. And just a few of the things that we do in terms of water equity. We also work with a coalition in Los Angeles called Stand LA, which largely we do our work in civic engagement around the city ordinance related to neighborhood oil drilling and phasing that out across the county and cities of Los Angeles as it can relate to chronic diseases and also reproductive, health concerns, and then plastics pollution and our beauty justice. I'm not going to go into detail for this because this is what the topic is here for us to discuss today, but you can learn more on our website, and we'll have our contact information there about our research project that we are doing with Taking Stock, Curls and Conversation workshops that we hold, with a professional within the beauty industry. And those are featured, as well as our advocacy, which we'll mention more in terms of the Safer Beauty Bill package in today's discussion. So with that, we'll move forward.
My name is Tianna Shaw-Wakeman with Black Women for Wellness. So from here on out, we're going to really be digging deep into the Non-Toxic Black Beauty Project, which is the reason we're all here today. And we're going to start off by going over the problem statement in depth, and then we'll have a conversation about the project in general, and then we'll also get a peek into the website and some of the resources that are there for you all. So Black women are disproportionately exposed to toxic chemicals in their workplace, communities, and from the beauty and personal care products that they use every day. In fact, beauty products marketed to Black women and girls often contain the most toxic ingredients used by the industry. Next slide, please. This framework is often called the environmental injustice of beauty. This toxic exposure is magnified by the fact that Black women purchase and use more beauty products per capita than any other demographic, spending more than $7.5 billion on beauty products a year and 9 times more on hair care products than the average consumer. Elevated exposures to beauty product chemicals in Black women are, in part, attributed to sexism, Eurocentric beauty norms, or societal preferences for light skin and straight hair, and racialized beauty practices, all of which can have long-term consequences on both Black women's chemical exposures and their health and well-being. And then when we think about the cumulative impact of the fact that Black individuals in this country often live more closely to toxic chemical facilities, might live in hotter neighborhoods, have less exposure to healthcare access, then when we think of the cumulative effect of experiencing toxic chemical exposure in your personal care products and in your environment, and maybe not having access to certain healthcare facilities or access to green space and all of these other things that we think of make a complete, full, happy, healthy life and neighborhood, then that overall effect can be great. Next slide, please. Thank you. So this slide shows just how big the beauty industry is. The $100 billion cosmetic industry uses about 10,000 industrial chemicals to formulate the beauty and personal care products we use every day, and 4,000 fragrance ingredients to make our cosmetic products smell good. These are industrial chemicals often used to grease cars, stabilize plastics, and even stabilize or sterilize medical equipment. Now, most people think that the FDA regulates the safety of beauty and personal care products the same way that it does food and drugs, but this isn't actually true. The reality is that cosmetics are one of the least regulated product sectors today. There are only 2.5 pages of federal law that exist to regulate this $100 billion industry, and that law hasn't been significantly updated since it was enacted over 80 years ago. And while the EU bans over 1,800 chemicals from using cosmetics, really over 2,400, linked to cancer, birth defects, and more, the US, the FDA, in comparison, has only banned or restricted 11 chemicals from the over 10,000 that are used. This means that many companies can and do legally use chemicals linked to cancer, birth defects, hormone disruption, learning disabilities, and reproductive and respiratory harm in the cosmetics products that are used every day by consumers and workers, many of whom are women of color. And I'll pass it over to Janet. Thank you.
Wonderful. Thanks so much, Tianna. So throughout this presentation, you might hear us refer to cosmetic product interchangeably with the words makeup or beauty or personal care products. And that's because the legal term cosmetic doesn't just mean makeup. It includes personal hygiene products like toothpaste, shampoo, deodorant, soap, sunscreen, etc. Products that we assume or hope at least that most people use every day. So keeping that in mind, take a minute now to share in the chat your best guess as to how many beauty and personal care products you use every day. 10 to 11, 30. Awesome. I like that people are being realistic. 5, 11 to 15. Okay, so this is great because in some presentations I have had many audience members say like 5 or 6. Now, tell me, after taking a look at this massive list that I've compiled on the slide, how many of you are thinking about rethinking the number that you shared? This is an important question because the Environmental Working Group estimated that the use of 12 cosmetic products alone every day would expose an average consumer to 168 unique chemicals, many of which are linked to harmful health effects. I think the number of cosmetic products that the average consumer uses is probably quite a bit higher than 12, likely double the number or even higher for Black women who buy and use more beauty products per capita than any other demographic, spending $7.5 billion a year and buying 9 times more hair care products than any other demographic as well. This is a sobering thought. The number of beauty and personal care products you use every day is directly related to the number of chemicals you're being exposed to, usually without your knowledge or consent, many of which are linked to cancer or other adverse health effects.
And I'll take it from here. Thank you so much, Janet. So as you can see here, Black women get breast cancer less, but die more from it. So just wanted to unpack what this means to us here. And so the overexposure to toxic chemicals in beauty products and personal care products, or as a whole, in the cosmetics industry, is especially problematic for Black women, because we already suffer from a higher exposure with a higher toxin load that we carry, and then higher incidence of mortality related to many of the health concerns like breast cancer and unequitable access to healthcare services, including preventative care, screening, and treatment. And so, for example, Black women get breast cancer at a highest, get breast cancer almost at the same rate as other racial ethnic groups, but we are dying more so. About 40% of breast cancer mortality rates can be attributed to Black women getting breast cancer, more so than any other US racial or ethnic groups here. And so as you can see here, the numbers in here are really, alarming in terms of the mortality rate and outcome. And just like to note here that the type of breast cancer we get is different than other racial or ethnic groups. We get a more aggressive type of breast cancer, the triple negative. Triple negative breast cancer compared to the risk of HR positive breast cancers compared to white women is more, on the rise within our community. And then lastly, touching on institutionalized racism contributes to a lot of these factors, such as the, social inequity creates obstacles to creating breast cancer prevention and increases our breast cancer risk. Next slide. So we wanted to have a little bit of interaction here. And so have a couple of questions here. And so the first one is, true or false, the majority of breast cancers are due to genetic history of the disease? If you can just drop in the chat what you feel is the correct answer here. And I see a lot of falses. Okay, I think we can go to the next slide and see what the actual answer. And for those who answered false, you are correct. about 90% of breast cancer is not linked to genetics. And so only 10% is. And so just to highlight that the majority of the correlation between breast cancer is linked to environmental or lifestyle factors. So you can see a number of factors or correlations linked here between alcohol use, tobacco, which are, some of the, lifestyle factors that are, amendable or changeable. Also chemicals and consumer products, which is the discussion largely that we're having here. And so looking at, our cosmetics, our beauty aids, and, hair care products that we may use. And then another factor is diet and nutrition. That can also be, a link or a correlation to breast cancer risk. And then place-based chemicals. And so where you live. So if you live in, a community that has, factories or maybe, linked to, toxic, chemicals, or either the line of work. We had a webinar on Tuesday, and we looked at, or we shared this same presentation to those that work in the beauty industry, salon workers and hairstylists. And so those are place-based chemicals and industry linked. And then, as I, mentioned earlier, just all of those cumulative, impacts can, have a greater, risk for breast cancer. And so what is going on here? And so we can see from this slide that you might be amazed, if not already, that to learn that only 10% is, can be linked to genetics, as we saw, largely 90% is to lifestyle and also to environmental exposures. And so organizations such as ours, Black Women for Wellness and Breast Cancer Prevention Partners, we are focused on looking at this other 90%, which is amendable or changeable in terms of breast cancer. And then just like to point out here that scientific literature shows that cancer-causing chemicals in cosmetics products, food packaging, which is also some other exposures, cleaning products, household, products, as well as home care, our workplace, which I touched on, and then also from the air that we breathe, the water that we use, and pollution in the land in our community, all have a contributing factor or link to the increasing rates of breast cancer and other chronic related diseases.
Thank you, Astrid. As you heard from Astrid, an increasing body of scientific evidence is, in fact, linking toxic chemicals in cosmetic products and other consumer products to increasing rates of breast cancer and other diseases. Cancer-causing chemicals like styrene, formaldehyde, long-chain parabens, phenylenediamines, and phthalates are banned in Europe, but legal for sale in the United States, and can be found in everything from bubble bath and baby shampoo to body lotions to hair dyes, hair straighteners, eyeliner and other makeup, and male products. So now for another quick true or false question. True or false? When it comes to chemical exposures, the dose makes the poison. Go ahead and put your answer in the chat. And this is something we're especially interested in hearing from you about, given you're all healthcare professionals. We want to know what you think. So we've got some trues. Interesting. False. Please explain the term. False. False, not always. Okay. Awesome. So the answer is false. The chemical industry argues that the dose makes the poison, meaning consumers don't have to worry about a little bit of a cancer-causing chemical in a baby shampoo or a bubble bath. But science is telling us a different story. There is no safe level of exposure to a cancer-causing chemical. And the type of exposures and the timing of exposures matters, and many are adding up to harm. The timing of chemical exposures matter because there are periods in our lives described as windows of vulnerability when chemical exposures can have a more profound effect. For example, prenatally, when the fetus is developing rapidly, tiny changes in the hormonal balance can cause changes in breast development, for example, which can affect breast cancer risk later in life. Low dose exposures also matter. When we talk about hormonally active chemicals, even low dose exposures may be of concern, and sometimes lower doses may in fact be more harmful than higher ones. For example, researchers have proved that unlike other chemicals, endocrine disrupting compounds or hormonally active chemicals appear to have more serious effects at lower levels than higher levels. And the reason why is these chemicals can act like estrogen, and our body doesn't know the difference between a synthetic estrogen, also called a xenoestrogen, or naturally occurring estrogen. And estrogenic chemicals may also trigger early puberty in girls and negatively impact their healthy childhood development. Now, women living with breast cancer, particularly ER-positive breast cancer, also want and need to be especially careful about their exposure to endocrine disrupting compounds that act like estrogen and could trigger a reoccurrence of the disease. And finally, none of us live in a bubble. We're exposed to toxic chemicals from the minute we wake up in the morning until the moment we go to bed at night. And as Astrid mentioned, a whole range of consumer products, including cosmetics and personal care products, as well as textiles, food packaging, building materials, occupational exposures, and place-based community exposures are contributing to the cumulative exposure that all of us are experiencing and adding up to harm. And yes, unfortunately, there's more. A 2018 study conducted by the National Institute of Environmental Health Sciences found that Black women who regularly dye their hair face a 60% increased risk of breast cancer, and Black women who regularly straighten their hair have a 30% increased risk of breast cancer. And if that wasn't bad enough already, this past October, a follow-up study by NIH found that Black women who regularly straighten their hair also double their risk of uterine cancer. And truly, breast cancer, uterine cancer, they're only the tip of the iceberg of the problem. This slide tells the whole story and makes the case for why toxic beauty products are a public health issue. Toxic chemicals in a whole host of Black beauty and personal care products, ranging from hair care products to feminine hygiene spray to nail products, have been linked to maternal health and reproductive harm, complications including infertility, less successful IVF outcomes, polycystic ovarian syndrome, uterine fibroids, pregnancy complications, preterm birth, plus respiratory harm, eye and skin irritation, and more. So right about now, you're probably thinking, how in the world can I wrap my head around this problem and do something about it? We know that nurses are not a monolith, and depending on the setting where you work, you may have more or less time to talk to your patients. For example, an OBGYN nurse or a nurse in a primary care setting would likely have more time to talk to their patients than a nurse in an ICU or in an emergency room. Plus, we know that in some healthcare settings, strict time limits are set for each individual appointment, regardless of your specialty. And besides the issue of there simply not being enough time in the day or during an appointment to discuss everything that you might like to talk about with a patient, there are other potential challenges facing nurses who may want to share information with their patients about these unsafe chemical exposures, but do not feel confident or competent enough to do so, or don't know where to look for follow-up resources for patients who want to learn more. Now, I'm not a nurse, but I spoke to a very smart nurse who is also a professor of nursing, and she's on the call today about this presentation, who said to me, Janet, nurses will be comfortable dealing with this issue if they have two things: something to say to their patients and something to give to their patients. And I really appreciate how she broke this down for me. So this slide presents the top 3 messages that we recommend you share with your patients. The first message states the problem. The second message affirms the right of Black women and everyone to shop with the knowledge and the confidence that their beauty products are safe, while reinforcing the message that that's not always possible. And the third message communicates that it's not all bad news, and that there are, in fact, resources and safer alternatives available, which in just a few minutes, Tianna is going to share with you. So take a minute now and please type in the chat, what do you think about these three top messages that we're suggesting you share with your patients? And again, we're suggesting you communicate these in your own words, but do they work for you? What's missing? How would you communicate with your patients differently? So I want to go ahead and just hand the virtual mic over to Tianna, who's going to dig in a little deeper into our non-toxic Black Beauty project.
Hello, and thank you so much, Janet. So for everyone here, we're really, as Janet said, going to dig into the resources that are available to all of you and to consumers and to your patients. So you've heard a lot about the problem today that Black women are overexposed and underprotected from the toxic chemicals in the hair care and other beauty products they use every day on their families and on themselves. The Campaign for Safe Cosmetics decided it wanted to do something about this problem. So together with leading scientists and nonprofit organizations like Ours Black Women's Wellness, working to improve Black women's health, it's been 2 years creating the campaign's non-toxic Black Beauty Project, which is what I want to tell you more about today. Next slide, please. So the campaign really has 4 clear goals. The first goal of the project was to raise awareness. First and foremost, raising awareness to manufacturer, retailer about the problem of hazardous chemicals and Black beauty products, because we as a society can't do something about a problem that we don't know exists, and everyone has a role to play if we're going to address this important public health issue. Salon professionals, consumers, policymakers, businesses, retailers, and healthcare professionals. And we also fundamentally in this work, trying to reduce toxic chemical exposure among people, we really strongly believe that everyone has a right to know about the ways they are being affected and the ways they are not being protected. So that principle of a right to know is very, very important when it comes to the raising awareness component in this work. Next slide, please. The second goal of this project was to help get actual safer products into the hands of Black women and girls. So with the help of a 19-member advisory committee, the Campaign for Safe Cosmetics created a list of 80 non-toxic Black-owned beauty brands. Made and sold by Black-owned companies, these products are free of the 250 toxic chemicals on the campaign's red list of chemicals of concern that should not be used in cosmetics. For the first time ever, this do not use list also includes chemicals linked to health concerns that disproportionately impact Black women. We created this database so women can shop with confidence, knowing the beauty and personal care products they're purchasing do not contain chemicals linked to negative health effects. Since this is the first year of the project, we're hoping that people can help us with the recertification process for 2023 and even to highlight or offer some suggestions for brands that we should be taking a look at as well. Next slide, please. The third goal of the project is to equip Black women with tip cards and other resources that they can trust that will empower them to make safer choices. And we have cards that are appropriate for anyone, and then cards that are more focused on healthcare professionals, retailers, and things like that. So this slide shows some of those exciting resources. And in a moment, we're going to dig into the website and I'll take you exactly where you can find them. So the fact sheets include a fact sheet that lists 51 of the top chemicals of concern found in a lot of the 8,000 Black beauty and personal care products we reviewed for safety last year. And there are also, the second big fact sheet is a list that explains the chemicals by category of product. And I'll show that in a moment as well. Another important resource is where you can find detailed information about these and other chemicals that impact your health, where there's a chemical glossary that you can search by product category, by chemical name, or by population. So a moment ago when Janet mentioned very important moments in our lives where chemical exposure can have significant harm, there is a section where you can isolate and specifically search by some of those moments. It also includes more information about state, federal, and international regulation of chemicals in cosmetics, and an action center where you can write members of Congress or companies urging them to do a better job of protecting your health against chemicals of concern in the beauty and personal care products that we all use and work with every day. And then there's a lot more resources. So the final goal of the project is to grow the safe Black beauty industry by elevating companies that are already making safer beauty and personal care products for Black women, and also providing technical support to Black-owned businesses that don't currently make the list, but that are trying to do better. So now I'm going to take a moment to share my screen, if I may. Okay, can everyone see the screen? Awesome. Okay, so this is the safecosmetics.org main website. So this is a wonderful place that you can go for all things toxic chemical exposure. And we also have the page here, which we're going to dig into, which is specifically for the non-toxic Black Beauty Project. So the Non-Toxic Black Beauty Project has resources for everyone. We're going to specifically today talk about the resources that are there for you all as healthcare providers, and then also resources that you can direct your patients who are often consumers to as well. So to begin, we will start off with, if you scroll further down the website, you'll see an area that's titled Black Beauty Tips. So the Black Beauty Tips website includes tip cards that are wonderful for consumers, wonderful for patients, but really it also includes these specified lists that include the highest chemicals of concern per product category. So sunscreen, body care, skincare, it continues. And these are all downloadable as well. We also have, these are the two PDFs that we mentioned, fact sheets, that one of the fact sheets has just the list of the 51 toxic chemicals, and the other is by product category. So we can take a look at each of those as well. So the one that you can look at, which is by chemical, you can also click on the chemical if you're looking at it on your website, and it'll take you to another Campaign for Safe Cosmetics page that lists why that chemical is included, properties of that chemical, and it will also list sources, resources that you can take a look at if you'd like to learn more. Now, I actually am a daughter of a nurse and my sister is a nurse. So I know that they are always asking me in this work, like, where's the study? Where's the study? And so I'm always sending them studies. So I know that's very important for a lot of people and for us as well, as this is definitely a science-based project. And then on the other list, as you can see, is specific to each category. So if you're looking at body care, hair care, makeup, then you can look down and see what are the toxic chemicals that you might be of most concern. And then speaking of, in addition to those resources, if we're thinking of the chemicals of concern and you're interested in chemicals of concern by population, then you can go to the toxic chemicals tab and click chemicals of concern, and then you'll see where you can filter. So this is where we mentioned that you can filter by babies and children, men, pregnant women, women of color, and it'll take you to a plethora of chemicals that are specific to those populations as well. Now, we're going to jump back to the main page, and we're going to delve into the database. So the database goes back to one of the goals we talked about, which is to make sure that we can get safer Black beauty products into the hands of women. So on this page is a database of the 80 Black beauty brands. And here you can see a filtering system. So you can filter by brand, you can filter by product category, you can filter by product type, and you can even filter by price range. So we're going to try that today, filtering by a bar soap, for instance. It'll show you all of the bar soaps, or if you're looking at shampoos or conditioners, whatever it might be, that are underneath the entire range of all 80 brands. So you can scroll down, you can click on a brand that might sound interesting to you. And then it'll show you the ingredients that are in that product, a description, it'll show you the price range, and then you can also go directly to that product's website and purchase the product if that's what you prefer. So the Campaign for Safe Cosmetics website, as we mentioned, really does have so many resources that you can dig through and in. And it also, the last thing you want to show is we did mention the Action Center. So if you go to resources and laws and regulations, then you can take action as well, if that's something that you're interested in. And it also shows alerts or things that are going on that you can keep up to date in. And one of the big projects that we are working on right now is supporting the Safer Beauty Bill package, which is a policy package that will help make the cosmetics industry cleaner through government regulation. So I'm going to take a pause now and turn it over to question and answer, and we can also use some of that time to answer any questions anyone may have about the website as well. Thank you.
All right, terrific. That was so awesome, Tianna. Thank you. And I especially appreciate that you pointed out all of the scientific citations that are included in the website. Laura Gillen, who is is a part of today's webinar, is the Black Beauty project manager and spent many, many, many hours and weeks of her life amassing all of the scientific literature that exists linking toxic chemicals in Black beauty products to negative impacts concerning Black women's health. So if you care about the science, it's there, and we really invite you to go ahead and take a look at the website. So now we've got about 10 minutes for questions and answers. And and look at my Cheryl. Looks like she's already ready with a question. So I want to invite you to do two things. You can go ahead and raise your hand like my Cheryl did, or you can put your question in the chat. And we'd really love to hear from you. So why don't you go ahead and can you turn your video on, my Cheryl, and tell me if I'm butchering your name?
Hi. No, it is my Cheryl, and I'm also not a nurse. I am actually an entrepreneur, and I am a personal brand product maker. So I make personal care products that's centered around holistic health. So I thought it was really interesting to see that there's a public health initiative to make clean products targeted Black women. My question for the project is, how do you go about soliciting brands to participate in your database? Do they have to pay? Is there a screen application process? And do you have to submit like a sample of work, or you just go based off face value and what they tell you is in the product?
Thank you. Thank you so much for that question. So this is the very first year that the Campaign for Safe Cosmetics has generated a list of non-toxic Black-owned beauty brands. And there are 80, as Tianna mentioned, Black-owned beauty companies that are making up our list of non-toxic brands. We came up with that list of 80 brands. We started with about 400 Black beauty brands from across the country that we amassed by doing internet searches, looking at fashion and beauty magazines and the lists and the beauty brands that they recommended. There were companies that were recommended by our advisory committee members. And in order to make the list, companies had to meet at least 3 criteria. They had to be Black owned. They had to primarily market to Black women, and they had to have their ingredients for their products on their websites. And that was required for entry into the vetting process. And then we scraped all of the ingredients from their products off of their websites, put them in a massive, massive database, and then compared those ingredients to a list of 250 hazardous chemicals that we researched, collected, and put into our red list of do not use chemicals in cosmetics. And for the first time ever, this list of 250 red list chemicals also included chemicals of particular concern to Black women's health. So if a product ingredient was on our do not use tier 1 list of red list chemicals, then the product got bumped out and the entire company was bumped out of review. They didn't qualify as being non-toxic. And something that's really different about our project is we're verifying the safety of the entire company and all of its products, its entire product line, as opposed to presenting, like some apps do, a product by product verification and stamp of approval. So that's how the process works. We're really hoping this year to expand the list of companies we look at and vet for safety, and we're wanting you to nominate your favorite Black beauty brand. And we're going to be providing, maybe I could ask Emily to put the URL in the chat that you would use to nominate your favorite Black beauty brand. So that was kind of a long answer because it was a really complicated process. But again, we hope next year to expand the list of non-toxic beauty brands so your favorite brand is included as well.
And just to add to that, yeah, there's so many great brands that are out there that need to be, visible or uplifted, indie brands, I'm sure, such as yourself. So we would encourage those, to be shared with us, or if you know of other brands. And as Janet mentioned, we're looking across the full spectrum. So some companies may have a really good, hair care line, but their body care may be, fragmented and, have things in it like, phthalates. And so just, wanting to encourage brands to have a really, clean and holistic, supply of products, or range of products that I should say.
Thank you for that, Astrid. And the other thing I just want to reinforce was a message that Tianna communicated, which is this project isn't about bashing companies. It's about lifting the industry leaders and then providing technical support to the companies who didn't make the list to help them do better. And we're working with a couple of strong science-based organizations to do that. So I see another question in the chat that I want to move to, which is from Catherine Dodd, and she's asking, how are these exposures linked to early puberty? And the answer to that question is yes, unfortunately. We know that currently white girls are experiencing puberty a year earlier than they used to, and Black girls are experiencing puberty 2 years earlier than before. And some scientists are pointing to endocrine disrupting hormonally active chemicals in consumer products as being part of the problem. And what we know about Black girls and their hair care use is that it really mirrors the hair care use of their parents and their friends and mentors. And from our own product analysis, we know that shampoos and hair relaxers marketed to kids contains even more toxic chemicals than some of the products that are marketed to their moms. So this is a real problem, and that's why a week from next week on December 14th, we're going to be hosting another webinar, a third webinar for Black women and girls, because we're hoping that moms can bring some of these messages home to their kids and make safer choices for not only themselves, but for their kids as well.
And if I may also jump onto that, so we work with and have worked with and have gotten wonderful presentations by a wonderful researcher from Harvard, Dr. Tamara James Todd. And she's done a lot of research on hair care product use used in children, specifically Black children, but multi-ethnic children, and how that might relate to early puberty, and then even more research in seeing if that has a correlation to later breast cancer risk. So I can post a couple of those studies in the chat as well. And she is a wonderful researcher. I'm always looking at all the things that she's doing in her position at Harvard.
Wonderful. Thank you for that, Tianna. There was another, let's see, a point from Abayomi Walker to everyone, who says, thanks for the presentation. There are apps that provide information on clean and green beauty products. For example, Think Dirty. What is lacking is whether those clean products are as effective for Black women and their needs. Will your list include just clean products? What is lacking? Oh, sorry, I'm missing the rest of your question here. Will your list include?
I can ask it if it'd be
easier. Thank you. Sorry. Thank you.
My question was because we are looking at reducing our exposure to potential endocrine disruptors and things like that, right? Will your list include whether the products are actually effective in doing so? For instance, if I'm switching to a green product and it's supposed to keep my hair smooth, right? Maybe I switch to a green product, but it doesn't smooth my hair. So I've wasted money on a product that's not as effective. And that's why you get a lot of pushback sometimes, because the cheaper, probably more chemically laden product may not be as effective for that woman. So will you have reviews on your list, or yeah, this actually works, or thumbs down, don't try this even though it's clean?
That's a really good question. We don't currently have the space for reviews, and that is certainly something that we could consider. And we'll talk with the team and see what they think about that, because I hear you. But again, like, some products work for some people and not for other people. But I do think this question of effectiveness is a really important one. So thanks for raising that.
Yes, and just to highlight, effectiveness is something that, as you know, Black women, or when we're doing our hair, is what we look for. Whether it's going to give the desired look, or help with manageability. So definitely something that we can look at for the future as we move forward with the project.
Yeah, I think it's also part of what we do is, well, for one, we always say that we're not here to tell someone how to live their life. We're only here to give everyone the information so they can make more informed decisions about how they want to live their life and what they want to buy and what they don't want to buy. So some people are always going to have their holy grail, ride or die products that they're never going to give up. And that's how it is. But we have other options. And we mentioned that. So we preach that, fewer products is better. If you aren't going to switch everything, we know it's hard. We know that it could be a price tag, even just to switch products, even if another product isn't that much more expensive. So we do understand that. And then we also know that some of it is kind of unlearning. So we know certain chemicals or products that we're all used to, certain feelings when it comes to like washing our hair. We're used to these big bubbles and all these things, but that isn't actually necessary for cleansing hair. And we're used to using certain curl creams that might give it a slick feeling, but that might actually be from mineral oil, which is petrochemical based, or it might be from silicones or different sulfates or things that aren't actually moisturizing, but are giving it that feeling of moisturizing. So some of it is, ride or die products, people always use them, and that is okay, I think. And then some of it is kind of an unlearning that I've even had to do in my own journey to use cleaner products, of kind of taking the time and necessary and learning to understand what part of this is maybe this product really isn't as effective, and what part of this is I just have to kind of understand my hair better and the product better, and those kinds of things. And it is a difficult process, because we've all been taught to use certain products that are highly fragranced and have a specific feel since we were very young. And so doing anything different, it is hard, and we definitely wouldn't tell anyone different.
So along those same lines, I think this will probably be the last question. There's a question in the chat from Brianna, who asks, what kind of alternatives are there for people that cannot afford the indie or more expensive brands? And is there a resource for products that people can make at home? So, so a couple of points there. One is, has to do with the fact that not all expensive brands are safe, and less expensive brands are toxic. I mean, sometimes the equation is exactly in the reverse, and that's why we offer the opportunity to search and filter by price point on our non-toxic Black Beauty product database, so that if you're looking for a less expensive product, you can find it. And we do know that there are many less expensive products there. So we're hoping that's going to help. But the other point I think that you're making is a lot of the brands that we're featuring on the list are indie brands. And we've heard some feedback that some of the bigger brands, like Shea Moisture and Briogeo, which are really popular brands, they're much bigger companies, aren't on our list. And I will tell you that I personally emailed the senior staff at Briogeo like repeatedly on LinkedIn, because we looked at their product ingredients, and they do look like they would meet the safety standard that we're upholding. But we also needed to get access to their fragrance ingredients, because lots of secret toxic chemicals can hide in fragrance ingredients. And they never responded to my emails because they don't know me, right? And they don't know the Campaign for Safe Cosmetics. And that's why we really need customers like you. And I can see Chantrell nodding. So maybe you use some of these products. We need your help. We need you to reach out to these companies, say, you're my favorite brand, you're not on this list. I want to nominate you. We'd love to get you on this list because we think you're great. So I hope that answers your question. We really want to grow this project, make it more accessible, make it more meaningful for you. And we need your help, and we hope you will help. All right, so just a couple more slides here. If you want to learn more, and we hope that you do, this slide shows some of the leading nonprofit organizations who are working on this issue. You can visit the websites of the groups that are sponsoring today's webinar. Again, that's Breast Cancer Prevention Partners, the Campaign for Safe Cosmetics, Black Women for Wellness, as well as our sister organizations, Women's Voices for the Earth and the Silent Spring Institute. All of us have lots and lots of information about the problem of toxic chemicals in cosmetics and the solutions that are available on both a personal and a political level. And I also want to mention that you can look forward to receiving from us a one-pager that we designed with some of the key messages and resources that we've shared with you today for nurses that want to help their patients navigate this important public health concern. So if you didn't take notes, that's okay. We're going to be sharing that information with you, as well as links to the downloadable resources like the tip cards and fact sheets that Tianna showed you during her part of the presentation. And it is 9:59. We've reached the end of our time together. I really want to especially thank Astrid and Tianna and Black Women for Wellness for being such a fabulous partner and for co-sponsoring today's webinar. And I want to thank all of you for giving us an hour of your day. We hope that you found this information useful, and we invite you to stay in touch. And here is how you can stay in touch. You'll see our email addresses on this slide, our social handles, and again, our websites. So please have a good day, take good care, and be in touch if you'd like to learn more. Thank you.